Dr. Hill here again, a very cool video coming up. Obviously, it's 2020. All comes down to COVID. We know that. We understand that. I get questions, calls, comments, texts. I mean, you name it, from family, friends, other dentists, other assistants, hygienists, anybody and everybody. What's going on in the dental office? Should I go? Should I not go? Do I need to call them? Do I even worry about going there? What's the plan? Well, I'm here to kind of give you a little rundown. Well, the World Health Organization is saying this. The CDC is saying this. The American Dental Association is saying this. At the end of the day, I am a true and strong believer that oral health is just as important as anything else. You have to remember that it goes into the systemic, right? We have big issues in our gums and our bones, and we're breaking teeth, and we have infections, and we have all that. That's all interconnected. So I do believe that your office is taking care of you properly. They're doing all the proper measurements, and I do believe that you do need to get into the dental office and making sure that you're doing your part as well to avoid any of these other issues, because as we know, dental problems come Saturday night, 3 a.m. when there is no one around. As someone once told me, all right, non-essential problems will become essential. What does that mean? Go to the dental office. Be taken care of. Most important, okay? A lot of the stuff now, okay, that needs to be done or that is being done on infection control in a dental office was standard prior to all this COVID stuff. It's just now being brought out more to the light, okay? You got to remember, in a dental office, there's obviously surgeries and saliva and stuff floating around and doing all that stuff. Dental offices are very, very serious about infection control. It is literally top priority, not only to protect our patients, most importantly to protect us, our families. We don't want to take stuff home like that, all prior to COVID. Now, it's just kind of ramped up a little bit. Let's talk a little bit about your visit, okay? You are going to see probably quite a few different things than you're used to. It's going to look weird, it's going to look different, it's going to feel different in most of the dental offices. First and foremost, you're probably going to have a very limited schedule on when you can even get into your office, okay? You got to remember, we're not supposed to have as many people in there. We're supposed to be further apart, which means, end all be all, less time for us to be in the office, less patients that we can see, all that kind of stuff. Now, that is out of our hands. That is coming down from the above. So don't be shocked if you call your office and they can't get you in for quite some time, okay? There's just nothing we can do about that. The other things, at the beginning, you're probably going to get asked a lot more questions than you're used to. Not only a health history, not only your information, all that kind of stuff, but you're probably going to get asked, where have you traveled to recently? Who have you been in contact to recently? Have you ever been tested positive for COVID or know somebody that has? All that kind of stuff. And honestly, a lot of the dental offices that I know, including ourselves, we usually are keeping our patients in the car once they get there, okay? We want to know everything is far away. We're trying to keep socially distanced. We're doing everything that we can, and most of those dental offices will do the same. You're probably going to get asked, please wear a mask into the office the whole time until you're sitting in the chair and the dentist, the assistant, the hygienist wants to look at your mouth. The other thing on the masks is you're probably going to see people that you're not used to wearing masks wear masks. So the people at the front, everybody in there will probably be wearing a mask at all times. You're going to see a lot of weird, as you're going to hear it, PPE. All right, all this protective equipment that you're going to see. You're going to probably see people wearing these weird face shields, okay, on almost all their procedures, which I have and I wear for every single patient. It's going to look different. It's not meant to be scary. It's meant to make sure that we are protecting ourselves as well as protecting you. Now, a lot of the other stuff that we will see, well, is something you won't see, and that's stuff that the dentists and the dental offices will probably do behind the scenes. Speaking for my office alone, we have a bunch and a ton of different more suctions that we use. We have certain ones where we can double down on suction. We have 2 suctions when we're working on patients' mouth. We have filters nowadays that are medical grade that a lot of offices went and got. Your dentist most likely is going to be open. Your dentist is going to probably have all these weird looking things on them and protecting themselves to try to protect you. And they're probably going to expect a lot out of you when you come into the office. They're risking themselves, right, as the dentist, as the assistant, as the hygienist, to take care of you, to make sure that we don't have any issues. So all I ask, and this is again from me being personal and being a dentist, is you got to remember, be patient with your dentist and your dental office, okay? It's not like we want to do all these things. We don't want to ask these patients 400 questions. We don't want to sweat all day wearing and looking like Darth Vader. It's not something we look to do, but we do it because we love what we do and we want to help our patients out. So just please understand that coming from a dentist, okay? And also please understand they're probably on a limited schedule. We can only do so much. but we are here to help you, okay? Now, that's just kind of a mainstream of it. That's a broad spectrum of it. Every little office is going to be different, and every single office is going to do different things. Now, in order for that to make sure that you feel comfortable, call your dentist, see what they're doing. Go ahead and ask them. We get asked all the time by patients, what should I expect? What am I doing? Our front office is trained to discuss this with them because they've been asked so many times in the last 5 months, and they're probably going to continue to ask for at least another year, okay? Because I don't see it slowing down too much, all right? Now, any other questions about that? I know that's kind of a quick video, a quick go-to, but it was something I thought, we should get brought up to, because now a lot more offices are open for elective procedures and the cleanings and that kind of stuff. So I thought it was a topic that we could kind of quickly discuss. But if you have questions, comment right here, ask me. I will always get back to you, or ask your dentist, whoever you're going to see, and I'm sure they'll be happy to hear you, see you, all that kind of stuff. So appreciate you guys. Look forward to seeing you soon. Thanks.